Welcome to a special episode of the Blue-lusional podcast. We are branching out a bit because, yes, we have the midterms coming up. Yes, there are candidates running, but there are other things that are involved to the makings of a politician and campaigns. So we are speaking to somebody different this week. We are speaking to the founder of Healthcare for Action, the largest healthcare PAC in the country, an associate professor at Harvard Med, Dr. Anahita Dua.
Thank you. Thank you very much for having me.
Yes, thank you
Thank
so
you
much
so
for
much for
coming
coming.
on. We're so excited to be branching out and talking to the people that, like Devin said, are really standing behind our grassroots politicians who are running for office, trying to make a difference. It wouldn't be fair for us to only interview these candidates and not talk about the people behind the candidates. And this is something we're really passionate about. And so we want to know, if you want to intro in who you are, that way everybody knows who you are and what we're doing here.
Of course. So my name is Anahita Dua. I'm a vascular surgeon at the Massachusetts General Hospital and an associate professor of surgery at Harvard Medical School. I'm a full-time vascular surgeon, so I'm operating constantly. But in 2022, after the Uvalde school shooting, basically, I have a young child, and I was very disturbed by the fact that, I've gone to school for 10 billion years. I pay my taxes. And here I am, kind of this helpless person that can't really do anything for my kid, who was actually starting first grade at the time. And so I ended up that night, I was on call. I went online and I bought a bulletproof backpack, which of course is not going to do anything for somebody who really gets, in a hail of bullets from a rifle. But psychologically, I was like, well, this is the best I can do. And then I started thinking, is it the best I can do? And that's kind of where Healthcare for Action was born, because it became this idea that, working in the hospital, I'm the queen of the castle, made it. But as soon as I put my foot outside in the real world, actually, all these patients are not getting the care they need. People are not, in the economy they need to be in. And we need to do something to change that. And since I am not running personally, and even if I was, it would just be me replacing another person like me in Massachusetts. What's the point of that? Thought, wouldn't it be great if we could get a bunch of people who are like-minded, but also have diversity in thought so that they can actually take on new things and understand different things and send those people to Congress and the Senate to make America great. And that's where the PAC was actually created.
Wow.
Sobering thoughts,
Yeah,
having to
right?
buy your child a bulletproof backpack. That
It's America.
And to ask yourself, that question of, oh, I thought in the moment that that's, the best I could do. And then I thought, is that the best that I could do? And I fully understand that. I think we've all had that moment, no matter what it is, when people say like, oh, I don't do politics. And we say, well, politics is going to do you. There's always that moment where it happens to you and you're like, okay, I guess I'll just do this because I think it's the best thing. It might not be the only thing that
Right.
we can do. And so, we're so appreciative of someone like you who said, hey, I'm in Massachusetts and we're very blue state. And so for me to run, it would just be another blue politician in a blue state. But looking around, there are other healthcare workers who want to run for office, which is insane. That workers are literally working so hard and then getting off their crazy 12-hour shifts and saying, I still want to do a campaign and run for office. Like, this is where we need to say, we need people to run for office who are boots on the ground and seeing what's happening every day. But my God, healthcare workers are like, we got to get in and fix this.
Right.
And
Yeah.
you're like, what can I do to help you guys? That is
And
just amazing.
we've interviewed a couple that there are some that are nurses, that they're first responders. So why do you think it is that we're starting to see so many healthcare workers start to run for office?
Actually, I think it's because there's been a shift in mentality. So, before we even jump into why these people are coming out, I think it's important to understand what the healthcare space is. I go to work and there's a patient, let's say, who's in the ICU. Okay. So patient's lying in the ICU and they have all these lines coming out of them. They have an infection. They have a vascular problem I've repaired. They need blood, all these different things. And you walk in and you see this patient, and I, as the vascular surgeon, say, I want you to give 3 units of blood to this patient. But the ICU doctor says, whoa, 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 we can't do that. Their lungs are not going to be able to take that. Maybe I can give a unit. We don't just stand there and start screaming at each other as the patient dies. We walk out of the area and we have a conversation. And, maybe I get 60% of what I want that day. They get 30% of what they want that day. The nurse gets 10% of what he or she wants that day. And ultimately, we do what's best for the patient to move the patient's progress forward. And in this analogy, America is the patient.
I
And
was like,
so
that's what I was
we're
thinking.
just like, all of us need to come together. So, it's not a matter of blue or red. I mean, even that in itself is stupid. There are definitely things where, hey, this Republican idea is not a bad idea. Maybe this Democrat can help execute this idea in such a way that everybody wins. And together, we can get the country moving forward. We know that the current Congress, for example, is the most ineffectual. But the reason it's most ineffectual is not because people are dumb. It's because they can't work together. You could put Einstein in a room with the guy who figured out the bomb, for the nuclear bomb that went off the Manhattan Project. And you're not going to get action unless they both sit down and collaborate and talk. So the whole point of healthcare workers is not that they're smart, is not that they're more driven. It's none of that stuff. It's because they learn from a very young age. We are taught you will not survive in the hospital if you cannot work with others. And even if that person has a completely opposite opinion and you hate them, for this patient, you put it aside and you figure it out. And that personality characteristic, unfortunately, historically, also came with a big need to be apolitical. Oh, I don't see politics. If I see politics, it's like seeing skin color. It's like seeing, it's a bad thing. I want to keep it out of my mind. But the problem is, like you said, Casey, earlier, you don't see politics. It's going to see you. And so sure enough, I'm sitting there again as a vascular surgeon. I do a 6-hour surgery. And then I need this patient to go and get this blood thinner. And they show up in the hospital 2 days later because they never picked up their blood thinner because the insurance couldn't cover it. And here I am doing another 6-hour procedure to try to open up what I just lost because they couldn't get. How is that not politics smacking me in the face at 2 a.m.? And so the reason you're seeing more people who are from the healthcare space shifting is because we as a community have decided it is okay to be political, because if you're not political, actually, that's a really bad thing for you, your patients, the hospital system, and they need you to step up and bring your expertise and your ability to work with others as a newcomer to Congress to help the world become a better place. And so that is why you're seeing the sudden influx of people who are ready to make that commitment.
Mm-hmm.
You hear that, guys? Everything's political.
These are the type of worker that see people through all walks of life as well. Growing up, when we've talked about like healthcare workers, we're always like, they see people in the best of times and the absolute worst of times. They see people from all different walks of life, all age groups, all races, all backgrounds. And to your point, when they're there, they're a patient. And no matter what you believe in your head, that all has to go to the side and you all have to work together to help this patient progress forward. And every time we've had a grassroots candidate on this podcast and we've interviewed them, they have all said that. They have all said that they are able to be the person that reaches across the aisle, because that's what we call it here, reach across the aisle and talk and get on a level that's not just, I'm red, you're blue, my party's not supposed to believe this and your party's not supposed to believe this, so therefore we can't even have a conversation. No, we need to figure out why this bill is here, who it helps, who it doesn't help, and figure out what way we can come together to help this work for the majority of this country. And yes, I do believe that the people that are able to do that are healthcare workers, are first responders.
Right. Because there is a deep sense of desire to help people. Even in this, not to jump right into this, but this horrible thing that happened in Minneapolis a couple of days ago now with the shooting, it's immediately there's, hey, we back ICE, and there's people who say, we back the protesters. And there's no, when I look at that as a healthcare worker, I see both. And what I mean by that is you have, the guy was an ICU VA nurse. So like, that's our people, right? That's who it was. And he clearly, I mean, the video is clear. Everybody's going to ultimately see it and make that's obvious that, like,
Mhm.
he was in a position where he definitely was not drawing his gun and nothing like that transpired. But at the same time, if you think of these ICE people as well, these are not highly trained people who have had a lot of military training or anything. Some of them are, but most of them are not. They're people that have been told, here's $50,000 to join, which is a lot of money
Mhm.
in this economy. And you have to take that into
Mhm.
account. You don't know if their mom is sick and needs a surgery. You don't know if their kid needs something new at school. And they've gone and joined and been sold a story, much like the military gets told. And then now they're standing in the middle of a protest where there's a lot of high anxiety things going on. People are yelling, they're afraid for themselves, and now you hand them a gun. A human being in that situation is going to go into a fight or flight response and going to do things that they wouldn't do if they were trained or in a cool mind. So really, I look at that as a healthcare worker and see both sides getting screwed by the government. You've got our ICE workers who are also US citizens who are being put in situations they should not be in. And you've, of course, got the protesters in situations where, unfortunately, you have these awful outcomes. And nobody wins here, right? Our country is losing. And I think a healthcare worker has the ability to sit down and say that. I don't want 10 million people who are illegal coming across the border not safely and, without papers. And simultaneously, I don't want ICE picking up people the way that they are and, walking into people's houses without. You can have both thoughts. And healthcare workers live in that space, are not afraid to say it. And I think that's going to bring together the centrist part of the United States
Mhm.
and the purple people that will come out and push this country again forward.
Hmm.
Yeah.
And what happened this weekend has really catapulted this idea that we need to start asking candidates what their stance is. We need to start asking them what they're going to do when they're in office about a lot of different things about healthcare, because we have a funding bill that is currently in the Senate and it might not pass. We're looking at another shutdown. Now people are asking the questions. And so, what reasonable promises should candidates be making when it comes to healthcare? Because a lot of people have a lot of thoughts.
So
Yeah.
at this point, the most important thing, seriously, in the United States is that they have to do their homework. We have to move away. And, if I had any slogan, the slogan I would say would be make politics boring again. If you are
Mhm.
turning off Jersey Shore
Yes.
and turning on C-SPAN, we got a problem in this country.
Yes.
We're doing stuff like that. And because everything is sound bites and everything is, posturing, and we need to go back to just data. Do we have a major problem with healthcare in this country? Yes, the data clearly shows that. Everybody agrees with that, Republicans and Democrats. What they are not agreeing on is how we fix it. And part of that comes from a lack of knowledge. If you walk into my operating room, Casey, with a knife sticking out of your chest, okay, and I say, okay, I am just going to pull this knife out and then stitch up the hole, you will die because it could have gone right through your heart. And without me collecting the data and understanding what exactly is wrong with you, I cannot make an intelligent plan. The problem that we are seeing is because everybody wants everything now, is that there's all this reaction to things. Oh, the ACA subsidies are going away. We need to fight to get them back. Okay, but then what is going to happen? Because they're coupons to begin with. Why do you need coupons to live in your country in the first place? The system is
Mm.
broken. So if
Hmm.
somebody cannot fix the fundamental underlying problem, and that can again only come with people who have actually lived these hospital relationships and how insurance companies work and how patients are getting put out with chronic disease. And until we have people like that in office who can understand that, coupled with epidemiologists, public health, and everyone gets in a room and says, this is the problem. Now we're going to work backwards to the solution. I mean,
Yeah.
for God's sake, we're putting people on Mars. We can't solve this problem. Please.
One
Yes.
would think, right?
Right.
And now we have access to social media and we're seeing healthcare and how it looks in other countries.
Mhm.
And it's baffling. For the first time, we really took that curtain down, and other countries are like, well, my maternity leave is a year. You
Mhm.
guys get what, 6 to 12 weeks if you're lucky, and no
Barely.
leave? That's crazy. Or I just went into the ER and walked out and I didn't have to pay anything.
Right.
And we're like, what? So now
Mhm.
everyone's like, okay, this whole system's what they think is reasonable. I think a lot of people are saying this. They want the whole thing stripped and to rebuild it from the ground up. And obviously, a lot of people are like, that is just not reasonable in the next year to
No.
years. It's just not reasonable. So it is good to say what's reasonable is actually working with people in healthcare, working with World Health Organizations to sit down and say, these are the largest problems that need to be addressed so that we don't just kick the can down the road, just keep, putting out the ACA subsidies over and over, which doesn't really help the problem, or just completely strip it and try to start over when we have a lot of problems right now. We can't just burn everything to the ground.
Right. And we have to
Yeah.
also look at other things. These problems are majorly complex. For example, one of the big reasons, I'll tell you as a surgeon, one of the big reasons that we have such immense healthcare costs. And again, this is one of the reasons, but just something that nobody's talking about, which everybody knows, is because we have a lot of defensive medicine in the United States. You come into the ER and you say you have a headache, I promise you're going to get a CT scan of your head. Is that the right thing to do? Those countries that you just talked about, the Britons and the Denmarks and the Canadas, you're going to get a head CT scan? Probably not. Why? Because out of 100 people, maybe one with that headache might have a brain tumor, but the other 99 will not. But that one person, to catch that one, because we have such a defensive culture about suing, there's worry, we want to push people through the system, we give all 100 people that CT scan of their head. And so that drives up the cost of health. Now, we have to talk to the American public and say, guys, are you willing to be that one person? And if you are willing to be that one person that may have had a brain tumor, we need a good primary care system that if you don't get caught in the ER, your primary care doctor will say, well, wow, my dear, you've been having vision changes. You lost a little weight. We need to get you in for that CT scan instead of you walking in through the front door. So the reason I bring this up is because tort reform, which has to do with changing how we have a sue culture, how we do defensive medicine, translates directly into how we would save costs, because then we would have certain protocols that wouldn't require all these shotgun things that are not necessary for a person with a headache. And that would then translate to lower cost of care, so more people could get it. But that only works if you have a solid primary care system, which we do not. And so that's the kind of thing that, again, a healthcare worker just sitting down would say, okay, that's the problem. How do we get a primary care system? And I'm telling you right now, if I sat in a room with the people that I mentioned, I could solve that problem for you within a month. We could do it.
So I think everyone wants this healthcare fix in like one midterm. We want what they got. So I think what you just laid out, I guess you kind of just answered this next question I have. Would that be your is that like one of the biggest priorities to fixing the healthcare system?
Not the tort reform element specifically, though that's definitely a part of it. The biggest problem with the healthcare system, right, is that we go right to the top. So we are very expensive in the way that we manage things because, again, you've got this headache. Do you need that head CT scan? And you may, if I'm sitting in front of you as a primary care doctor, I will assess that. And then I will determine whether or not you need it. And the problem with the other countries that you're mentioning, Casey, again, the Denmarks and the UKs and the Canadas, is that they have another problem, which is if you do have that brain tumor, you can't be waiting 2 years for that CT scan. That's not going to fly either. The American public's not going to tolerate that, and they shouldn't, because we cannot say we're going to decrease quality in exchange for quantity. Because you tell me, if I gave you two scenarios, in scenario number one, I tell you 50% of the United States is going to get excellent healthcare, top of the line, but the other 50% get nothing. Versus everybody gets healthcare, but it's subpar. It's not perfect. What's better? And both are bad, and we shouldn't accept either. We're in the richest country in the world. We got the smartest people on the planet. We should be able to say, how are we going to sort this out? And so to answer your question, Devin, it's not simply about exactly, there's not just one fix. There's a systematic problem. And we have to say to ourselves, what's important? What's fundable? We already, we say, universal healthcare, we're all balk at it, socialism, and there are many problems with that, of course. But Medicare is already socialism. That is what it is. We are paying into a system, but then, so could you extend some basic level of care for everybody? We probably could, but then what is that basic level of care and who decides? And that is really where sitting down with other people to determine what the best course of action is and then bringing a plan forward that has all of the forecasting, as if you're the CEO of a company. If I do this, how does it impact that? That's the type of thing that we need to be doing. But because we're in such a rush to get it done, we're putting together glass that can shatter at any second and really help nobody, because the primary goal is not appropriate. We're trying to win elections, not trying to help people.
Mm-hmm. Yes.
Mm-hmm.
And we don't
Yeah.
want to get in and have a bunch of, because if you ask people what they want fixed in healthcare, you are going to get probably 1,000 different responses.
Mhm.
This is how the rabbit hole has gone down, especially after COVID. I think so many people have unlocked a bunch of new fears when it comes to health in our country after a global pandemic that was not handled properly. And so people are going to get in and say, we need to mandatory vaccinations, because that's getting dicey with the administration we have now. We need to manage our flu seasons. We need hospitals to be opening, not closing. We need more hospitals, more primary care offices, more insurance company. Like, everyone's going to have all these things. It can be very overwhelming, I'm sure, as a candidate to hear people calling in and saying, this is what I want you to do. Like, what is actually reasonable? And you can't have it all, guys. We can't win back in the midterms and magic wand fix healthcare.
Universal.
The most reasonable thing, honestly, is that the candidates have to be able to say, I will sit down with the other members of Congress, all of them, and I will come up with the best solution for this issue. And it is, and don't make false promises. You cannot say that this is going to happen in a year. In fact, if it happens in a year, you should be wary of that, because that means that this candidate, again, is just trying to win elections. This is going to be something that is going to take a decade to come. Even what we currently have has taken like an evolution of 60 years to where we are today. And, it reminds me, I went to medical school in the United Kingdom, and there are many places, and of course I live in Boston, and there are many places where there are these kind of like old, beautiful buildings that nobody wants to tear down. And so then they've built these like beautiful kind of glass buildings around it. But if you just take a step back and you look at it, it looks terrible. Right? Because ultimately there was no city planning. It was just like, well, we can't tear down this building. It's historical. So let's just build this monstrosity next to it. And everything just it doesn't work. And you're not making a proper use of the land. You're not appropriately, giving people what they need. Traffic then gets injured, et cetera, et cetera, et cetera. So even though you think you're preserving something because it's more difficult to tear it down, even though it would take longer, you're actually causing more trouble. And healthcare is kind of the same way. That's a good analogy that you need to, in our case, in the United States, we really need to be doing some tearing down. What worked when our population was half what it is today is not going to work today. What worked when medicine was half what it was today. I mean, today you have a cough, you get that CT scan. Just 30 years ago, that was not the case. Your primary care doctor would walk in with their cigarette and, feel you and, talk to your mom who was also their patient. And those days are gone. So what are we going to do? Now you have AI coming in. Can you use this to accelerate? And the government should be front and center. It's like our new industrial revolution. And so it's not just about health. It's about making sure that the United States as a group moves forward. And you cannot do that unless you've got a candidate who can talk to others. So I come back to your original question. What is reasonable? What is reasonable is for a candidate to be able to say that I am a human being. I understand that people can change and I can also change. And I can listen to the opposition. I can listen to the arguments. I can data crunch in my mind. And then I can tell you what I think is the best solution and put it through the House, put it through the Senate. That is what you want from a candidate.
Right?
That'd be amazing. That sounds amazing.
But it sounds reasonable. It sounds reasonable.
It's doable.
Bare minimum.
Today.
Yeah, it sounds doable, sounds reasonable. And I am actually very excited to hear your answer with this, because we say that everything is political. I don't think there's anything that can't be turned political. And when we think of healthcare in politics, I think your brain just automatically goes to cost of healthcare or access to insurance to get medical attention. But what are the other ways that healthcare affects politics and areas of of healthcare that most people just aren't thinking about when they think about politics that you see?
I'm just as excited to answer this question as you were to ask it. So here's the thing, and actually, this is really important. So Healthcare for Action, which is our organization, basically works to put good people in office. That's what we're doing. It seems like such a simple thing. The healthcare element is, and this is why so many healthcare workers are starting to come to the forefront, that it is not about access. It is not about vaccinations. It is not about those CT scans. It is not about any of those things. It is about all of those things and the ability for you to get to your job, get paid appropriately, and take home enough money to buy a house. Healthcare is you sending your children to school and being happy with their level of reading, being happy with what the teachers are teaching them, and feeling like your children have a future based on the education that they're getting. Healthcare today in Boston, we had like a 16-inch dump of snow. Healthcare is the snowplows being able to get on the road and appropriately plowing them so that I can get to work and people who, the emergency services can get out. So healthcare is everything. There's nothing that healthcare is not. And one of the mistakes that we have made with healthcare historically is boxing it in this thing of like, I go to the hospital and I have a cough and then no. It is a system that allows you to lead a happy life with liberty, which is what? American principles. And so Healthcare for Action is all about, we find candidates that will do these things for you. Look, if you and I are in Congress together, okay? I'm a doctor, you're not a doctor, let's say. And we're having a discussion about a road that needs to be built across the United States. And maybe you are fully against abortion and I am for abortion, let's say. But we're talking about this road. We should be able to sit down and have a conversation and be able to move forward in what the best thing is for the US for that transportation system so that maybe that transportation system can allow certain goods to go to X state that now will, develop more jobs, that now will result in a hospital, and now will allow that entire community to uplift. That is health. And so when Healthcare for Action is being actionable, what we're saying is get out of this mindset that we're only talking about what you think baseline is health-related stuff.
Everything is healthcare.
Yeah, everything is healthcare. When you think about it, yeah, you can absolutely. I think so many people make the argument that's like, why would I care about healthcare? I don't even go to the doctor.
Exactly.
Like, or I go once a year and I'm fine. Like I have this conversation with my husband all the time because I'm like, since this last year, I'm like, when have you gone to your doctor's checkup? He's like, it's fine. I'm fine. And I'm like, what? Because I think of healthcare like you do. I think of it in every aspect of life.
Hmm?
I'm constantly thinking about it. Every time an ambulance drives by, I'm like, wow, I wonder if they have
How
enough
much was that?
ambulances. I wonder, yeah, how much ambulance ride or, the staff during a snowstorm. My first thought was, I wonder how many of them had to stay at the hospital because they need workers there,
Hmm?
like they do at hurricanes here in Florida, where they make you stay there. They have crews that stay in the hospital and sleep there so that they have enough staff. Everything, everything is political, and so is healthcare. Healthcare is everywhere. You cannot escape it.
Right.
So that's the answer I've been wanting to get.
Yeah, people need to hear that.
Oh,
They
it's
got to hear
completely
that.
true. I mean, even if you never, ever, ever go to the doctor, you get up and you want to have a job that's paying properly. And
Mhm.
if the economy sucks and you're now sad, that's healthcare. Like,
Yeah.
that's part of part of the whole system. And then, of course, that's going to make you behave a particular way that can affect how you interact with your family. That's healthcare. Everything is connected. And so it's important, that's why they say a healthy society is a thriving society. You can measure, I mean, that's how they do it, actually. The metrics of a society that is successful is measured in their health, which is
Mhm.
one of the reasons why America is sending off so many red lights right now, because we're not, we all know this. I mean, we're all human. We all live. People are angrier. People are sadder. And, it's easy to say, oh, it's my cell phone. No, it's not. My cell phone is my best friend, actually. It's not. I mean,
It doesn't Wi-Fi doesn't cause cancer.
Wi-Fi does not cause cancer, not Wi-Fi. No, no, no. The Cheetos you're eating while playing on Wi-Fi, maybe. No, I love Cheetos. I love Cheetos. But, there is an important element of this that, people do need to get. And so when you go out there to send people to office, that is what you're actually doing. You're sending a person to office. And whether they vote blue or red, if they are an asshole, they are not the right person to go. And we need to go back to basics.
Yes.
Why did we pick
Yeah.
those founding fathers? Because they were the brightest. They were the most intelligent. They collaborated. They sat down. They did the right thing. And that we need to go back to first principles. That's what they say in health. Even if I have a patient in front of me, I don't know what's going on, I go back to my basics. All right, let's go through the systems. Companies do the same thing. The government is broken right now. They need to do the same thing. And we need to start by putting the right people in office who are not there just trying to get reelected, who are there to really make a difference. But then we as the American public also have to set up a system for them where they can succeed. If we're going to say you need to get elected every 2 years, and we say that money is the way that they need to get elected, then of course they're going to spend 50% of their time fundraising and not doing their job.
Yes.
If we set up that kind of system for them, what do we expect? It's our fault.
Mhm.
So we need to actually get in there and make these changes, and it can be done. Healthcare for Action is a great pack that allows us to select people. I do the selection personally with our board. We really just check. We do the asshole test to begin with. And then after that, we say, what have you done? Can you keep with it? Are you going to be committed? What type of person are you? We kind of stress test them. And then once we decide that this is really a decent human being with the smarts and the drive, we support them.
Yes.
Okay.
That's how it
I
should.
like that.
It
Mhm.
is. And I mean, I went and looked through on the website, some of the candidates who are running, and just reading the bios. All I had to do was read the bios. I'm like, perfect. Sign me up. Where do I go vote? Because again, all of them are so happy to be in healthcare. For one, that's when you know that they are in it for the cause. Because if you are working in healthcare, again, seeing the highest of highs, the lowest of lows, and you have such a passion for it, then I can only imagine if you are choosing to also run for office and get into politics, that you have such a passion for people being able to have a healthy, sustainable life where they get to go to work, come home, be with their family, and not have to worry about going to the hospital if they have to, or being able to feed their families, or being able to have health insurance or any insurance, buy a home, all of those things. You have to be passionate about it if you want to spend your time in office after also working 12-hour shifts in hospitals or in the healthcare world. So when I read them, I was like, all of them, sign me up. These are the people that are going to really, to your point, sit down and say, how can we make everyone's life better? Not just Democrats, not just Republicans. Everyone deserves a good life, a sustainable life, healthy life. That's not up for discussion,
Right. And if you truly
Yeah.
keep that as your North Star, you really can because you keep going back to that main point, and then all the rest becomes just noise. And we all have that, in our lives as well. One of the interesting things about healthcare workers, is that sometimes they're painted accurately so as very joyous, kind of almost idealistic people. I just want everyone to hug and kiss, and the world is a lovely place. Believe me, we deal with serious issues. I mean, death in our face, certainly for me and the job I do, and the true cycle of life, the unfairness of life, when a child gets sick, for example, or, a situation where somebody just, is trying to help somebody else and they get hit by a car. We see all that. So we also understand realism. And that is an important thing to say because it's very easy to stand up and have all kinds of dreams. I dream that everybody has money to have a house and everybody has the best education possible and that's just not life. So you have to say, in reality, how can I make something work? And part of the problem that we are seeing right now in politics is the Democrats are kind of painted as these idealistic kind of utopian people that want everyone to have everything. And the Republicans are like, who is going to pay for this? And actually, both sides are right. Who is going to pay for it? And at the same time, everybody should be happy. Somebody has to sit down and say, all right, this still maintains the core, But if we do this and this is how we would pay for it. Or maybe we can't pay for it, and this is what we do differently. Again, healthcare workers are very poised and equipped to deal with reality, which is what currently we could use a dose of in Congress and the Senate. Please.
Yeah, yeah. We had a government shutdown over that, and
Reality.
that's when we saw the ACA subsidies were discontinued. So, can you speak to the effects that's going to have on people health wise and economically?
Of course. So before we jump into that, we should explain what the ACA subsidies are because, it's kind of like with a lot of the healthcare stuff, imagine you got a friend that comes over and plays video games with you for the last year. 1 year later, you can't ask them what their name is, right? It's just awkward. So similarly with healthcare, people are like pre-authorization, Medicare, Medicaid, ACA subsidies. And people are like, what is that? So let me just begin by like, what is it? So the Affordable Care Act, the ACA or Obamacare as it's called, was basically this idea that if we force more Americans into the insurance market, like they're going to pay into the insurance market, then we will be able to lower costs for everyone and give more people insurance. It's a little more complicated than that, but long story short, more people get covered. Pre-existing conditions get covered. So if you had diabetes before, you'd still get insurance to cover you. And then if you're doing that, because overall everyone's paying into the pot, then everything can be a bit cheaper. And then there was back and forth between the Republicans, Democrats. And ultimately what happened was it wasn't the exact plan that Obama wanted, but it was decently close. But one of the things that was kind of baked into it was if you are going to pay, let's say $1,000 for insurance right now based on the 4-member family that you have, we're going to give you a coupon. Because, just when you go to a new store, they give you a coupon like Sunday. Yeah. So you got a little bit off. So they're like, come on, join the marketplace so that we can get involved. So they give these coupons to people. People are like, whoa, I can get family insurance, $300, 4 people covered. Awesome. They do it. But the fine print on the coupon was it expired now.
Mhm.
And so because it expired suddenly, a number of people who are part of that insurance process who are ready to just pay their $250 again next year suddenly get a bill that says, whoa, 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 I got to pay $3,000. And they got a shock. And that's where the back and forth. So the Democrats were saying, guys, don't let the coupons expire. Give them more coupons until we figure this out. And the Republicans are like, figure what out? Like, there's no plan. You guys have had all this time to figure out a plan. You haven't. We haven't. We can't just let this keep going. Who's going to pay for it? Both sides are right, frankly. And so at the end of the day, now we have a real problem because they did expire. The coupons did expire. And now we're moving forward into this new year where a number of people either literally cannot afford it. So they're kicked off completely. They do not have insurance. That will translate to showing up to the ERs, which will then translate to an overwhelming of the ER, which will translate to worse healthcare and possibly death for people. The projections are in the thousands. Death for people who otherwise would not have died. There's a subset of people that will try to pay, but then they're going to cut money from their other things, maybe education. Maybe they were going to get a degree this year. They're not going to do it now. Or maybe they're going to be living hand to mouth. And that type of thing, of course, really has an impact on families. And so ultimately, because we don't have a plan, the biggest thing that's going to happen is we are going to see hospitals closing and patients getting sicker. And it would have been really nice before cutting the coupons to have had some degree of a plan in place. But that's going to be the immediate effect that we see as we go into this new year.
Big yikes.
Yeah.
Not good. Not good.
Not
Not
good.
good.
No.
Not good, my friends. And that this is where we come in and tell you that there are healthcare workers running for office who know
Plenty.
that we need to fix it instead of just giving you a coupon every month.
Right.
We need to actually go in and figure out why this isn't working and fix it. So this is what we mean by showing up to the polls informed, and not just informed as to what's happening around you, but informed as to you have looked into the candidates. You hadn't just gone on the 411 voter website and looked at the overview, that you actually looked into these candidates, what they want to do, and that you are showing up to the polls and you know why you are voting for who you're voting for. Not just because they have a D or an R next to their name, not just because you think they're cute or you like the way they talk. It can't be that anymore. We have to, this is the year we can actually make some headway and vote the right people into office. And again, I think these right people are going to be people like healthcare workers, grassroots candidates that are not in it for fame, for fortune. They are in this because they actually care about people and they actually want to fix the things that are just so corrupt and just so broken at a astronomical level at this point. Yes, the ACA, everyone wants them extended, but I agree with you. We can extend them all they want. If there's a way to fix it so we don't have to continually come back to this every 3 months, that would be great too.
Right. Exactly correct. We need to take this issue. This is the next frontier. There are certain elements that a country has to take care of before it can kind of go to the next level. And this element of health, we have always, no pun intended, put a Band-Aid on. And we've been doing it for years. We've come close a couple of times. I was a 2023 Presidential Leadership Scholar, which is a program that President Bush and President Clinton run every year. And they kind of talk about this collaboration. Again, Bush is a Republican. Obviously, Clinton is a Democrat. But how they moved through and how they were presidents, how they had leadership. And this is really key that like we have come close. We can do it. But there was always some political force that kind of knocked it off and made it not important. But at this point, it is one of the fundamental things because, again, who wants to cycle through government shutdowns every few months? And nobody wants a quick fix anymore. We're ready for this to be taken care of. The next big thing, of course, is education. The education costs in this country are out of control. And if you don't have an educated public, you're not going to have a happy public. You're not going to have a public that can engage in the things that you want them to engage in. And so there's certain big fundamentals that we need to get back to that America was built on. These are not new things.
Yep.
But we need to come back to them and say, look, we got to put a little bit of time, investment, and money into this. And we have to ensure that we can do it to the next level. And the way to do it is this way. We've got to go to kind of anti-establishment, people who are fresh ideas, fresh faces, not because there's not anything wrong necessarily what people have done, but we need new stuff. Even right now with the NIH, the CDC, the FDA, these established programs, is there a way that we can do things better? Yes. But you need, again, new people to come in and talk to you about that. And I'm not saying new people who have no credibility. You can't just pluck someone off the street and say, oh, go and, do something that a 10-year person in Senate could do, because they need to understand the system. But there are people that were on the school board that then ran for state council, that have been state senators for 5 years, that are governors, that are now running for Congress. That's the guy that you need to go and support because they know what they're doing and they have chosen the path regardless. And so Healthcare for Action, again, what we do, to what you were saying earlier, Casey, is not only do we support these candidates financially, but we actually do a lot of commercials and whatnot for them to explain to the public what their positions are. And we do big town halls to explain to people. We say, bring the stupidest questions and we will sit there and answer. Not because, because again, like, if you asked me to talk about law, I would know nothing. I would want to start from the beginning with the basics. And that's what we're saying. Come one, come all, sit down and ask me all those questions and let me answer for you what is really going on. So that's what Healthcare for Action does at its crux. But the big thing is winning back these midterms.
Yes. Yeah.
Yes.
Because leading into this next question, healthcare has been all over the news this week. Multiple things. Obviously, the ACA subsidies. We are also seeing some hospitals start shutting down. And we all learned this week that the United States has left the WHO, is what they call it. It's the World Health Organization. This isn't too much of a shock. Obviously, put in an executive order when he went into office last January saying, I'm gonna do this soon.
Immediately.
Obviously, we all saw that happened this week. And those are, I know we had talked about earlier, those are some of the people that Congress should be sitting down and talking to when we are passing legislation that has to do with healthcare. And so what are the consequences of this? And especially for candidates that you have under the Healthcare for Action PAC running, knowing that we are not a part of WHO anymore.
Well, to answer this, we really got to go back to history. And honestly, for a lot of the things that we do, we got to go back to history a little bit. America was fairly isolationist up until we had the bombing in Pearl Harbor.
Yep.
The world was going to shit, frankly, with with World War II. And, America kept saying, we don't want to get into it. We don't want to get into it. And, we're lucky from a geographical perspective. And we certainly were back then, of course, with the big ocean between us and Europe. And we sort of said, hands off, because we want to take care of our people, which is appropriate. I mean, of course we want to take care of our people. That's what we should be doing. But then the Japanese bombed Pearl Harbor, and then we had no choice, and we had to get into it. And when we did get into it, we formed alliances with other nations, and then we created a new world order where we emerged as the world leader and have stayed the world leader since that time. A lot of people don't know that before World War II, actually, again, America was, if you look back at, what the GDP was, how we were trading, what we were doing, we were not on the world stage. World War II did that with us.
Mhm.
And why? Because we were on the right side of history. We made the right collaborations. And after we won, we helped, as we know, Japan become the superpower it is today. They thank us for that, and they're right. We helped other countries in Europe that had made the mistakes. We didn't just put them all in jail. We said, okay, how are we going to build this new world? And that is basically what you call soft power, right? Having the ability, which is something, by the way, China is doing wildly right now, which we can get to in a moment. But basically, the issue with withdrawing from USAID, withdrawing from the WHO, is that we lose our world position and we kind of go back to almost the isolationism.
Yeah.
And that's dangerous, because if everybody else was doing that, that'd be fine. But everybody else is not doing that. China, for example, is absolutely not, as I mentioned. And we don't have to fear them, but we do need to respect them and say that this is potentially somebody who, if they take the entire world on their side, we could have a problem. And it's not going to be good enough to fight. Yeah. And if you look at Africa, if you look at South America, how is China doing it? They're going and building hospitals. They're going and helping people, with responses. In fact, there was a very famous response, I think it was out of Africa, where an American diplomat asked somebody in Africa, why do you keep taking money from China? Why do you keep engaging with them? And they said to this American diplomat, whenever we ask China for help, they give us money. When we ask America for help, they give us a lecture. And it was a very interesting, because we were that previously, right? Doing that. So it's a long-winded answer to basically say that by withdrawing from the WHO, we're losing that soft power. We're losing that ability to maintain a world order. We just saw in Davos, Carney out of Canada talking about a new world order and the shift. And that's a big deal. And then the secondary part of it is, forget all the world order, forget the soft power. The WHO serves as like a library. This is a thing I read in an article, which is a great way to be described. It's a library of all kind of the diseases out there, all the pockets of things that are going on. And America can walk into that library at any time and check out a book on whatever is going on in the world at that time before it hits the United States and hurts us. We lose that ability when we withdraw from the WHO. So we lose data. And anytime you lose data and information, you become weaker. So by withdrawing from the WHO, and really what we're doing is it's a punishment for what happened in COVID. I stand up myself and say, yeah, there were multiple things done very wrong in COVID. I myself was not for it, even at the time. But now we don't want to cut off our nose to spite our face, right? We want to make sure that we're in a position where we maintain that soft power, we maintain the world order, we stay number one. And what we should be doing is not withdrawing from the WHO or messing around with, USAID. We should be focusing on the economy, focusing on AI, focusing on energy, so that we stay in this position as the world leader, focusing on education, not going after our major institutions. And again, these are the types of things that, once again, Healthcare for Action focuses on, because we recognize that is the way to maintain our presence in the world.
Yes.
Is there anything we can do to make up for the data loss? Because I know the information that's shared amongst countries with I guess if there's a pandemic to happen, we wouldn't even have it on our radar. I'm guessing, is that right?
That is right. That is how the WHO works, because no one is hiding anything. It's data sharing. It's not like they're just collecting it. We pay into it. Then everybody collects. And, our scientists may be the ones that say, guys, I'm noticing a pattern here. I forecast that XYZ is going to happen. We're going to lose all that. And it's not hysteria. It's true. I mean, it's just
Mhm.
the saddest thing about it. I think the part that hurts the most is, if you study world history, there have been many amazing nations that have gotten to the top with all the right principles, hard work, the community coming together, ensuring that, we have a fair society that has merit and social mobility based on how hard you work. And again, I'm all for merit. I'm 100% behind that. We educate the public and then we let everyone off to the races. Of course, the world is unfair, but that then allows for the best and the brightest to shine and continue to push our country forward. And that's what America was founded on. That's what Rome was founded on. That's what the UK did many years ago. And you can go back in history and see these major nations falling because they start to fall to certain ideology. They start to fall to certain types of behaviors. They try to push kind of social engineering that isn't exactly human nature. And then that ends in problems constantly. And you fall into this cycle of, you did it to me, I'm going to do it to you. But in this particular case, we're not fighting an outsider, we're fighting ourselves. We're not in a civil war with bayonets, but we are kind of in a civil war of ideology right now, and it's hurting us
Yup.
so badly.
Mm-hmm.
And we
Yup.
just have to just say, stop it. And these are the new candidates. And let's maintain, everyone wants America to be number one. Everyone wants America to thrive and every American to do great. And that's what we need to go back to, those first principles.
Mm-hmm.
We all want the same thing. That's the craziest part. We all want the same stuff, but
Yeah.
we're
And we're taking
amazing.
it on ourselves at this point, which is another reason I'm sure why Healthcare for Action came to be, is that we now have to support each other financially, emotionally, to help each other get into office and make some headway. We started this and we said, we're not going to talk to people who are taking APAC money, big corporate PAC money, because a lot of times those people, their votes for legislation are swayed by their large donors, and sometimes they wouldn't make the decision that's best for the district, for their constituents, or just the best all around, because we say they're bought and paid for. So when we said we were going to start interviewing grassroots candidates, and we started hearing that there were PACs being built by everyday people to start financially helping these grassroots candidates, because you don't even realize how expensive it is to run a campaign, to even get on the ballot,
Get
and
on
then,
it.
and then to get your name out there. If it weren't for social media, I don't think grassroots candidates would be able to get their name out there at all. We need to support them in every single way we can. And so it's just the average everyday person is now helping on levels that we didn't think were possible. So seeing you really build up Healthcare for Action and say, I myself am not running, but I'm going to help those who are, and financially get them on a website, get their name out there, do everything that I can. It's another form of activism that just like opened a door,
Mhm.
I think, to a lot of people that might be feeling like they want to do something like that too, whether it be for healthcare, maybe for veterans, start something similar for them. Because I would love to see our elected officials from all different walks of life. I'd love to see people who are in healthcare, people who are veterans that understand the military, maybe people that work in tech and really understand what we need in order to move forward as a country and continue to remain number one. Parents, just people from all walks of life. Those are the people who are going to sit down and talk to each other and make the best decisions, not just it seems like we want celebrities in office right now. And that's
Very
just,
strange. Very
we don't
strange.
need celebrities in office.
Definitely.
No, never again.
They won't be good at it, and we don't want them there. I totally agree with you. I mean, of course, that's the dream. You want people who want to do this job, who are passionate but also grounded, and who are able to get in there and say, this is the thing I care about. This is the thing you care about. How can we make it work? It doesn't need to be veteran against healthcare worker, so to speak.
No.
It is actually one conglomerate that helps, across the board. You're totally right. What's interesting, about that, what you said about APAC money and what you said about PAC money, of course, people are beholden to their donors. And that therein lies the fundamental problem. If I could change one thing about the way that we run politics, it is campaign finance law. That is the actual root problem, because we set them up for failure. It's not the person's, frankly speaking, we know, like I'll give you in Boston, for example. $2 million is the minimum to dip your toe into running for Congress in Boston.
Wild.
$2 million. You need to have it out the gate. You have to pay your campaign manager. You have to pay to get on TV. You have to pay, and it's sort of like, when you're getting married and you go to a venue, the venue will jack up the price because they know it's your wedding and you'll pay. That's what the TV stations do. That's what the radio does. So they know, this candidate, up it goes. Oh, it's election season. Boom, boom, boom. And so these candidates are paying immense amount of money. In fact, we have a joke in politics where we say that the primary is not actually you competing with someone else. It's whoever raises the most money, that person won the primary. And and so if we set up a system like that for our candidates and then get mad at them for taking the APAC money, it's our fault. Like, we're putting them in a situation where they're kind of forced to, because their logic to themselves is, okay, I'll do the right thing, but I'll take the money up front because I can't do anything if I don't get elected. I hear this all the time. But then, of course, once they get elected, it's a never-ending cycle, right? It doesn't end.
Like, hey,
it starts when you get elected.
You thought you were getting a free ride?
No. Oh, no. Now everyone comes to collect. And this is not just, by the way, big PACs. This is also big donors. And, so the point is that, again, who can change campaign finance law? Congress, the Senate. You get the right people there, they'll do it. And so at the end of the day, what I've been telling people with Healthcare for Action, this year, we have a fundraising goal. What I like to do is the first, beginning of the year, we do a lot of media. So we're teaching people about why this is important. Then after that, we do fundraising, and then we spend on the candidates down to every single dollar. Not a dollar is wasted. You donate to Healthcare for Action, you will not get a tote bag. You will get nothing other than the candidate. We don't. And so we give everything back to the candidates, and we specifically figure out what they need and ensure that they get because different people are different. Somebody running in Arizona has a different set of rules, a different set of needs, than somebody running in Maine. Yep. And so we come and we help them based on what they need. And then beyond that, as I mentioned, educate the public and identify a bench, because we're not just thinking about this election cycle. What about 30 years from now? We need somebody who's been working in this space who now is ready. So you want to build a bench. And that's what Republicans are excellent at doing, by the way. They are actually. Yes. We don't do that. We just show up and say, you look good and I like your shirt. Why don't you run for Congress? Vibes.
No more of that, please.
Yeah. No. You have to. There are two ways that you can do it. One is with your time and the other is with your money. With healthcare workers, of course, I don't have time. I can't go door knocking, but what I can do is make a donation. And when you make a donation to the right PAC that is going to use your money and be a good steward of your money, then you really can make quite a fundamental difference. And in a way, it's kind of beautifully elegant in the sense that there's nothing more to it than that. If you have enough money, you usually will win. It doesn't happen always, but that's typically the way it works. Whoever raises the most usually wins.
Yes. Right? That's just, and historically, yes, because the more money you have, the more news stations, the more TV appearances, the more billboard, whatever you do,
recognition,
or you're getting out
more
there.
eyes.
And people vote on, they're like, oh, I recognize that name. Yeah. I'll vote for, I saw their billboard that they had. I saw them on that TV show. And so, yes, that's typically what ends up happening. And thankfully, we are in an age of social media where there is somewhat of a free aspect to starting a TikTok and Instagram, or, going on podcasts where they don't pay you to go on. And for people watching, we do not make these candidates pay to come on our show. We're not like that. Nobody has time to pay money to come on to our podcast, but some do. But there are these aspects. And so that's why we are out here using what we have, which is our time, to start pushing out candidates in the way we know how to, which is through social media. But not everything's free, guys.
Right.
Please remember that. Flyers, door knocking, campaign managers, people to handle the finances that come in for the campaign, transportation, because some of these districts are large. We've interviewed people that they're going from top to bottom, 2-3 hour drives to top to bottom, depending on what you're running for. You might have your whole state. So if you want to go door knocking, you're staying in hotels, you're driving, gas in your car, nothing is free.
Exactly. And a lot of times these candidates have given up their jobs. So in healthcare, for example,
Yep.
what you can do with our candidates, you can do a little bit. We have nurses that do 3-4 shifts a week, or we have doctors that will cover, but a lot of stuff is not shift work. For example, my job is not shift work. I am on call at all times, because if I have a patient that's been operated on and wants me, I have to be an OB-GYN doctors. They got to show up. There are actually very few healthcare workers that truly do shift work. And so what ends up happening then is that they have to sacrifice and say, I don't even know if I'm going to win, but I'm going to give up my cushy job.
Yeah.
And I'm just going to go out there and I'm going to do. So the sacrifices that these candidates make to even run are immense. And, we tend to think of them as these like fancy hoity-toity people that can just do what they want, these billionaires. That's not the case. And that's also not who you necessarily want, somebody who's just got another feather to put in their cap. Well, I've conquered all this real estate and I've, and there's nothing wrong with people who are successful. I am 100% behind them. They actually are sometimes the quiet voices that put in the big checks that allow these candidates to move forward. So I have nothing against them. But at the end of the day, they're doing well in their sector. And if you can get somebody who's, again, grassroots, who understands the day-to-day, who's not removed from the public to go and represent, that is ultimately what the American foundation is, right? For the people, by the people.
So love language. Love
That's
to hear
it.
that. Okay. So if you're able to pull RFK out of his current position, who would be your ideal secretary of HS person to hold down that position?
So the ideal person that runs HHS needs to be a combination of somebody who really understands healthcare, who's been in the healthcare space and gets how patients move from place to place, what the health inequities are, and what the kind of public health view is, but also somebody who really understands administration. The ideal person is almost like a healthcare CEO, because they oversee so many different elements of healthcare within the United States and then have to see how they all cross with each other. So to be honest with you, I don't have a name of a person
Well.
that I would say, hey, yeah, this guy. At this point, though, I would say literally anybody else.
Isn't it?
To answer your question, I don't have personally, I actually feel, with RFK, like he really believes what he's saying. And that's in a way really quite, it's unfortunate, Some of this stuff is not off base. Like chronic disease really is a problem. We really do need to focus down on things that make Americans sicker. Americans are sicker. Currently, in this day and age, for the first time in American history, we are living in a time where your child has a lower life expectancy than you do. For the first time. Something is wrong. RFK is right about that. But then as soon as he jumps into what we're going to do about it, we're like, whoa.
Okay.
That's
it's not Tylenol.
That's not it. That's not it. And so but I almost feel like there too, there's this like, let's quick fix it. Like the answer's been in front of us all this time. Let's just grab it and the answer is not. It's a complicated thing that needs to get money invested in it to study. It's going to take a decade to figure out. And so the person who I would choose to lead HHS would be a human that would understand that would not be burdened by other people forcing him or her to come to a decision right now. It would be somebody very, very boring who just is like, I just want to come to work and read these documents and synthesize information. And that's the type of person that you want in that position.
That sounds amazing.
Make politics boring again, because it
That
should
sounds
get
so
to the point
good.
where we're like, who is the secretary of HHS?
That's exactly where we need to be.
I long for the days of not knowing who that was.
I know.
Or knowing who the congressperson is in Colorado District 3.
That's it.
I don't want to know that.
Yes. We just got to move away. It's all the one-upping. You're going to be weird, so I'm going to be weirder. And then my friend is going to be weird with me. And then you and your friend are going to be, and we're like, what are you doing? And you know what? The patient is dying in the room while you're screwing around outside, one-upping. And we as the American public, what can we do? We can stop standing by and being entertained by this trash. They are performing for us.
Yes, it's performative. Yes.
Right? So we have to say, I don't like this show, man. I want to go back to C-SPAN. I want to
Yeah.
go. Don't like, we as Americans, it is cool. It's cool when you see someone fighting the man. It's fun to see someone be anti, the establishment, the underdog come out. That is a very American phenomenon. Our country was built on that. But now it's not cool to see that and then see everybody kind of losing in a fire. That's not
Yeah.
what we like. And a lot of Americans are getting uncomfortable now with this back and forth.
They
This
are.
is not
Yes.
sure.
We don't have
Tell the
time for it.
WHO, you guys, in your plain language, how you handled COVID kind of sucked. And and
Yeah.
they say, okay, but then beyond that, you don't need to sign an executive order to pull out of there. Just say, okay, let's fix it.
It's
What are you
very
doing?
emotion based. It's giving, okay, you can't really say women are too emotional to be in office when we are witnessing quite the opposite right now. And yes, the glorification of politicians, the
Has to
fan
stop.
edits that are, happening online because one politician finally said F ICE and
Yeah.
everyone's like, oh my
Yeah.
God, they're swearing, they mean business. Back and forth arguing. While it can feel empowering to, when you think your politicians aren't doing anything, to hear them say something like that, in the moment, you're like, yeah, great. But then when you sit back and go, okay, but then they just went home and they went on recess and they went on whatever vacation, and we are still here in the bad place in the bad
And like
times. So I
and like
don't
we
really
said, we're
care that he said
dying.
F ICE because he didn't do anything else.
Right.
When are we gonna go back to the basics where I don't know if you're on recess or not? I don't know who your representative is. I only know who mine is. I don't know who the secretary of HHS is. It needs to get back to that.
Yeah. Yeah.
We can watch
To
reality.
go to second order thinking. I mean, ICE, I heard it described very, ICE is a government institution with a very specific job that is important to the safety and security of the United States, that has kind of been co-opted into this, whatever it is currently. And, it's being sold in a funny way. There are people that are coming in that are not exactly what the government institution was meant to be. But then we don't
Mhm.
want us as the American public to also start revolting against our own institutions, because that's part of the plan, right? When you
Yeah.
take these
Totally.
institutions that are supposed to be your protectors and supposed to be things that we have fundamental trusts in, like the Fed Reserve, like, the again, something like ICE, the law, the Supreme Court, and you start to healthcare, and you start to say these establishments are against you guys. Join us to overthrow them. And then suddenly you're standing in a barren country with no establishments and no country, because that is your country. Those establishments are what embody the laws and the feelings of the United States citizens. And
Hear that,
so,
leftist?
strange. Yeah, well, that's the point, right? So we have an issue that we need to deal with, but I think we need to stop being manipulated ourselves, is what I'm trying to say ultimately, and I
Yeah.
feel like we are.
Mhm.
Yeah. The back and forth is silly. It's really just a waste of time at this point. It's like, grow up, get serious. Like, we actually have shit to do. Like, people are dying, Kim. Like, that's
Yes,
where we're
that
at.
is
People are dying.
on the table, flatlining as we speak. Like, we are not, this isn't funny anymore. It's just,
No.
so many people are saying that in comments now. You're seeing it like, this isn't funny. Like the SNL skits are like, it's not funny anymore. This is like real life, and we need to
I
log in and go to the polls.
Yeah.
I felt the
Yeah.
cognitive dissonance happening in my head as I saw a video of Alex, and I opened up the comment section and I saw memes, and I was like,
We've lost.
We have. Well, because
and
it's
then
not
another,
real, right?
it's
Social media
it's
is not real, and you can
yeah, so
disconnect
don't
easily, and you're hiding behind that screen. We know that, right? But these people who are putting up the memes, who are saying these terrible things, if they were in that situation, they themselves would have probably run to help. Because again, that is the one thing to say. I've lived across the world, and I will
Mhm.
tell you, Americans are very, very special people. Like we're unlike anybody else from Europe, from India, we're just a very unique group of people. And one of our greatest things is that we don't see kind of caste or rank, or we sit next to the person next to you. You just sort of banter, and social media is taking some of that away and making us an us versus them. We've never been that way. And all you need to do to prove this to yourself is go drop in the middle of Ohio and meet the first person at Walmart. And you'll be like, this could be my best friend. It's the weirdest thing. Talk about
Touch
cognitive
grass.
dissonance. You know, you just need to go back to that. We really, and I think if I could kind of set up one thing, you know, I mentioned this once before. One of the reasons that the country really came together historically around the, you know, World War happened and then kind of the 60s and 70s was because we had a common thing, which was the space race. And everybody was
Mhm.
like committed to
Mhm.
making us the number one. We even went so far as to have gifted and talented programs where the government would actually identify children that they thought were like, you know, further ahead in science and math and cultivate that, whoever they
Yep.
were. And, you know, we have that going on right now. It's not the space race, so to speak. But there's AI race, all these other things we mentioned. And I
Mhm.
think the Americans need to turn and focus on that. And our government will follow us if we do it because they want the votes.
Yeah,
Just
they
be cool, guys. Just be cool, everybody. Just be
Just
cool,
be
guys.
cool.
the one thing we need you guys to do is to please vote. Just
Please.
please vote.
You can donate to a PAC. I'm
Donate.
sure a lot of people don't know that. You can donate to a PAC. You can start with this one.
Yeah. Oh, that would be wonderful. And I will be an amazing steward of your money. I promise you. I am very, very accessible. And so if there's anything, if you go to www.healthcareforaction.com, which is all one word,
We'll have
healthcareforaction.com.
it in the bio.
Yeah. Oh, thank you. Right there, you can see the media. You can see who we're endorsing. You can see what we've done historically. And there's a big contribute button. And again, you're not going to get that tote bag, but you're going to get the best people elected to Congress
Yes.
and Senate.
That sounds good.
Don't want to
That
tote
sounds
bag.
so good.
I would like
Who needs a tote bag?
the tangible thing I would like is them in office.
Yes. Yes. And give
It's
you
an
that.
investment.
Yes.
Mhm.
Perfect.
All right.
Yes. Everybody should be going to Healthcare for Action. You can actually look at the candidates. Maybe one of them is running in your district and you had no idea. That would be even better.
Yes.
This is another way how you can get yourself involved. You say, what do I do? Is it, do I
I'll
just show up to the
cheer for
ballot box
them.
and that's it?
Mm-hmm.
Healthcare fraction.
That's
Yes.
right.
Let's start here.
The ballot box ultimately, you know, is made up of people. And so those people, you want to send the right people there as well. The ballot box is full of garbage and garbage in, garbage out. And so,
Mhm.
and part of that is the problem. You know, people who want to run are worried about the incumbents that are already there. An incumbent is a person who's already been in that seat for maybe 2 decades. And you're like, oh my God, I can't upset them. You'd be surprised. This is the time more than ever that the American public is really looking for something different because we're all sick of this. To your point earlier, it's not funny anymore. It's been going on for a long time. It's just making all of us depressed. It's putting neighbor against neighbor. We promised we'd never do that after the Civil War.
Yep.
And we're
And
seeing
almost,
history repeat itself a bit. And so we want to stop that before it gets really bad. And this is the way to do it. And
yeah.
I love what you said earlier that people either have time or money. So you should have one or the other, at least somewhat of it. And so if you have the money and you can donate, that's great. If you don't have the money and you're crunched on money, if you have time, you can share Healthcare for Action. You can share it with your friends, with your family. You can follow the candidates and follow them on their social media pages because when you're looking at their stuff, it pushes it out into the algorithm, gets it out to more people. You can post videos and make content, hyping them up. There's a lot you can also do with your time. If they have town halls, go support them at the town halls. Be there. There's so many things you can do. Obviously, money is great, but there's other ways that you can get involved that will help them make money and help them get the funding they need. So this is why we do this because, you know,
Thank you.
it helps. It really does. And so we appreciate you coming and spending some time with us on the podcast. And I think you've put a lot of people at ease because tensions are really high right now. And I think people need somebody of rational sound in mind to come on and say, guys, we are not, they all say they're cooked. We're cooked. And so we hear that all the time. So we like getting people on there like, we are not cooked.
No.
Okay, there's a way out. And here I have put my time and energy into creating this tangible thing for you to show that we are not cooked.
Correct.
Yeah.
Correct. we get the midterms and we show, because again, we're only in year 1 of 4, right? And
Ugh.
again, there are, we still have elections. It's okay. We still
Yes.
have, everything is fine. But, I think, all administrations, no matter what they say, are truly beholden to the people, unless they're a true dictatorship, which we are not yet. We are not, we are not. And saying we are is not, I mean, it hurts real dictatorships, and we're not there yet. And so it's important to say that, they are watching very closely. And if the midterms go blue, it is an indication to the current administration that we don't like what you're doing. And they will course correct because they don't want to lose the presidency in the next round, right? So the best thing you can do right now is put all of your time and efforts into course correcting, which is, of course, to ensure that we go blue. And the way to do that, as we've already discussed, is to vote, and is to ensure that the right candidates are out there, and do a lot of political stuff that can actually advance the country from today.
Yes.
There's
And
so
that
much.
involves not even midterms, but the primaries, because you get to actually choose in the primaries which Democrat is going to go against the Republican. That's
What a
crazy, guys.
concept.
I know that's a crazy concept. And so these grassroots candidates, some of them are going up against large corporate PAC donor officials who might already have seats, or running for re-election, or this is also their first time running, but they had a lot more money given to them. And so it is really important that we don't just vote for the person who might be getting the most money, but the person who is most fit for the job. This is a public servant job, and we shouldn't just be voting for the most influential celebrity billionaire for the job. No. So make sure you are figuring out when your primaries are, and that you are registered to vote. Check it once, check it twice, check it 3 times, be informed. And then when you're instead of doom scrolling at night, go to places like Healthcare for Action, take a look, get yourself informed. And if you have even $5 to spare, this is where you should be spending your money this year.
At this point, if you ask if you don't know when your primary is, I'll tell you. Just ask. Please, I'm begging you.
Don't say you're too tired, okay? You cannot say you are too tired for her, okay?
No. No.
Literally a surgeon at Mass General Hospital in Massachusetts, and on the side, creating this amazing pack for healthcare workers. Thank you.
As a side.
Wow, it's an important thing to do. We have to do it. I think we have to build things that people can actually use as vehicles. Because there is no greater, and I see it. I see it in the hospital, and I see it. And I've lived it myself. Of course, there's nothing that takes the spark out of a human faster than hopelessness. If a person feels like nothing can be done, it's hopeless. I mean, even our patients, they will die if they believe that nothing can be done. They just wither away. I don't have an explanation for it, but it is a thing. And there are people out there on the Democrat side that are, in hysterics about what's going on with the administration. Everything is, the worst thing in the world. They're living in this constant state of, stress and cortisol release. And it doesn't need to be that way. Every single thing that comes out of the administration is not wrong. It's okay to say that these are the things I like, these are the things I don't like, but overall, I would prefer this person in office. Let me make it happen in an intelligent way. If the Titanic is sinking and you're standing on the deck screaming, you are going to die. If you do, you know what? I'm going to stay out of the water, and I'm going to do that thing, and I'm going to make sure that I push her off the board so I have space so that I don't, if you do that, then you're much more likely to survive. And so in a situation of crisis, you must keep your wits about you. And we are in some degree of a crisis, certainly in the Democratic Party. But it's going to come down to you as the individual, because no one's coming to save you. You got to do it yourself.
I feel like that's what we're that's the scenario where everyone's like, oh my God, we're going to die. And we're like,
no,
wait, we can do these. There's some things we can do so we don't.
You could just get on this lifeboat right here. I'm just saying.
And like, no, that won't work.
No, no. But the rest, all you can do is try, right? And it is true. Like, there's a bunch of little things that will coalesce to be, and everyone's kind of doing their part. But that is really important to see, that there are kind of these big umbrellas, and just pick one and get under it.
Yes.
And that's good enough.
Mhm.
And the healthcare
Yeah.
workers are like, don't worry, guys. We will clean this up.
Yes.
Don't you
Yes,
worry.
we will. Don't you
Even
worry.
any broom behind you, all right?
Totally.
Yeah.
Don't
Totally.
worry. So
I've
if you
done
take
vomit, I've done poop, I've done I have no problem.
right?
Bring it.
Right? Don't
So
worry.
trust her with your money.
If you take anything away from this, please trust her with your money. She's doing very good things. And I think healthcare workers, we praise them obviously just for the work they do in keeping people alive every single day. But beyond that, also wanting to pass good legislation, be in office, and help this country move forward. Of course, yes, healthcare workers, you are amazing. You are a godsend. You just chef's kiss. I mean, we love you guys. And we can't wait to watch these primaries unfold. And now is the time to donate more than ever. So please make sure, after listening to this amazing episode, that you go to healthcarefораction.com. And if you can donate again any money, please donate. If not, please give them your eyeballs and help them get out to more people. And we're just so thankful that you came on.
Thank you so much.
It's my absolute pleasure. Thank you for having me. I really appreciate it.
Thank you. And
Yes.
guys, make sure you're tuning in every single week for a grassroots candidate because the next one coming out might be somebody who works in healthcare. I don't know. Ooh, fun. And make
Stay
sure you're
tuned.
subscribed. And we will see you on the next episode of Blue-lusional. Have a great night, everyone. Bye.
Bye.
Bye.